Hi, I'm Leonie and I've been a psychologist for around 20 years. And when I'm not counselling people, I'm giving seminars on things like dyslexia because that's an issue that's very passionate for me. And for that reason, when I work with clients, I use a whiteboard and markers. And the reason for that is that I think sometimes a picture is worth 1,000 words, and it also helps us to remember things better. So one of the things that I often start with is to describe the physiology of what you might be experiencing in your body, particularly in the brain. Understanding how the brain functions can often help to explain the symptoms that we might be getting. And that makes them feel a whole lot less scary. And then I work through a number of different areas that might be contributing to the unpleasant feelings that you might be having, the unpleasant state, like perhaps anxiety or undesirable behaviours that you might have, such as perhaps eating disorders. So there's sort of 4 areas that we look at, the thoughts that might be contributing to those unpleasant situations. Thoughts that might be perhaps a bit negative, thoughts a bit like the glass being half full. Feelings that you might be experiencing, loneliness, anger, guilt, shame or fear that you can't manage to overcome and may be quite overwhelming. Also, body sensations that you might be experiencing, such as pain or panic, gut disturbances, sexual dysfunction or insomnia. And the 4th area that can contribute to those situations is memories from the past and beliefs that you might have that might also have been started in the past. And they can contribute to perhaps PTSD type symptoms and feelings of being unworthy and unloved. So there's lots of different forms of therapy that we can use to try and address those 4 areas. In the thoughts area, cognitive behavioural therapy, you might have heard of CBT, when we actually have a good look at what's going on in your head and what you're thinking and reframe that into a more positive state. In the feelings area, we use emotion-focused therapy, which looks directly at the emotions that you're feeling, but goes behind those to what's perhaps the primary emotion that you might be feeling, that's masked by some other emotion, like perhaps anger, really masking a sense of loneliness. In the body sensation area, I use a number of different techniques that address those physical symptoms quite directly. So things like biofeedback, as well as medical hypnosis and visualization. In the memories area, it's a very interesting area, and it sometimes takes a bit longer to get behind where some of these beliefs might have come from. So we use what's called a psychodynamic approach, going back in and looking at your attachment to your primary caregiver and what experiences you might have had in your early life. In the memories area, you might be experiencing ongoing trauma and PTSD type symptoms. So once we've gone through those 4 areas and learned a little bit more about what's the contributing factors for you, we'll hopefully have also developed an understanding and some strategies and some concrete ways that you can deal with these issues and hopefully have resolved them in the first place so that in the end you don't need me.